You're going to be sitting to the right-hand side of your client when you're working on the masticatory muscles on the right-hand side. So that's the position I'm in here. The masseter muscle inserts into the side of the mandible here and originates from the zygomatic arch. So your access point is going to be to reach in between the lips. And you're not in the mouth proper, you're not between the teeth, you're just actually in the cheek. And as you proceed posteriorly, then you're going to run into this muscular border here of the masseter coming down like this. If you're not sure that you're on it, you get the person to clench their jaw and the muscle will perk up and into your finger here. So you need to explore the masseter all the way from the inferior part of it all the way upwards. And I like to come into the contact with the border of the muscle with my inside hand, and my outside thumb rolls the muscle onto my inside finger. And in doing it in this way, I can scan the entire muscle for myofascial tension. In order to access the temporalis, we need to understand the temporalis attaches all along this region in the skull, and it reaches underneath the zygomatic arch to insert into the coronoid process here. An interesting anatomical fact is that the anterior fibers of the temporalis attach along the anterior part of the coronoid, and as you proceed more posteriorly with these muscular fibers, the tendon attaches more and more posteriorly along the coronoid until the most posterior fibers attach along the back margin of the coronoid. So to contact the muscular insertion of the temporalis, we need to reach into the mouth again, and once again you can just be in the cheek. You should feel the back of your finger along the lower margin of teeth as you proceed posteriorly. And then you'll run into this plate of bone, which is the mandible, and you run up along the inside with your finger pad. And you get to about this point, and you're going to run into the first insertional tendon of the temporalis. So if it's swollen or sensitive or hard or firm, you're going to usually find hypertonic fibers in the temporalis in the same region. Very often you might just treat just the first few millimeters in here of the coronoid and the first few muscle fibers of the temporalis the first time out. But as things progress, then you're going to be progressing along the inside of the coronoid process. You might run into some obstacles here, so at a certain point it's helpful to ask the client to open their jaw a little bit, and then you can sink in higher on the coronoid process. The next muscle I'd like to explore is the lateral pterygoid muscle. It attaches in this blue region on the front of the neck of the condyle of the mandible, and it comes from the lateral pterygoid plate, which is inside the skull here. This is the pterygoid. It's the lateral pterygoid plate here. So the muscle actually runs in where my finger is, although it attaches on the inside here. Let's just take the jaw off for a second. So you see along these teeth medially, and you'll run into sort of a firm gum-like tissue, and that will be the belly of the muscle. Sometimes you can come in underneath and you can contact the muscle this way. To access this muscle, I like to stand up and I walk around, and then I open the jaw and I slide my finger along the upper set of teeth, and then I proceed more medially until I run into the pterygoid, the lateral pterygoid plate, with my forefinger here. So I'll strum it or contact it. As the muscle relaxes, sometimes I'll just shift the jaw a little bit posteriorly in this direction to stretch the attachment in there. That's the lateral pterygoid muscle. The medial pterygoid muscle comes off the medial pterygoid plate of the sphenoid and inserts onto the inside corner of the angle of the mandible here. So some people will access the muscle from reaching in this way. If you need to access it internally or intraorally, then this is the potentially gaggy muscle. So you need to open the jaw, have the person open the jaw, and then you reach in between their upper and lower teeth. And you have to be on the inside of things here. you'll run into the pterygomandibular raphe, and you go a little bit more posterior to that, and you'll run into this muscular wall of the medial pterygoid. When you get to that muscular wall, a gentle pressure that's directed towards the external auditory meatus tends to isolate your force, so it's at right angles to the muscle. A gentle contact there, some patience, both therapist and client breathing, and that muscle will often relax nicely.